Dr. Angela Rasmussen recently testified before Congress on this very issue. She is a virologist at the Vaccine and Infectious Disease Organization. You also recognize her name because she also was the virologist that we counted on to help guide our show through the pandemic. She joins us now live. You can also watch on YouTube. Good morning, Dr. Rasmussen.
Good morning, Ursula.
Well, let's just start with this poll, which I find worrisome, that 1 in 6 parents have either delayed or skipped vaccines, and 9% skipped polio or MMR. From your perspective, how big a red flag is that for public health?
I mean, it's a huge red flag, and I think it goes to show how prevalent disinformation about vaccines and public health has been since the pandemic and since the current administration came into power. People who have opposed vaccines, effectively anti-vaxxers, have been really, really good at distributing this disinformation. It's information that is incorrect about vaccines, that overstates the risks of taking vaccines and grossly understates the benefits of taking vaccines. And this is before those vaccines have even been removed from the market, which is unfortunately what I believe that the current HHS Secretary, Robert F. Kennedy Jr., is looking to do.
What role, let's talk about political identity or ideology. What role does that play in vaccine decision-making that you are seeing, well, I would say across the country, but around the world?
Well, I think certainly in the U.S., but also abroad, including here in Canada where I live, there has really been a push to effectively get revenge on public health officials because of the pandemic. And this is understandable to me. I mean, the COVID-19 pandemic really upended everybody's lives, and people are trying to make sense of that incredibly disruptive event. And this has created a situation in which people who actually profit from distributing this vaccine disinformation, because in many cases, they will say, don't take the vaccine, take these supplements that I'm selling instead, or take, this course that I'm selling instead. Go to my preferred doctor who will charge you out of pocket for treatment instead. I think that has really created an opportunity for some of those people to sow misinformation and disinformation about vaccines and essentially profit from people making their families less safe. Here in Canada, we've had similar things, even though currently the Public Health Agency of Canada and Health Canada are very pro-vaccine and are very evidence-based, as the U.S. used to be. We've seen record measles outbreaks in Ontario and Alberta this year that were even bigger than the one in the U.S. and Texas. So this attitude is really prevalent. It's not for the betterment of public health. It's really so people can consolidate power and people can make money off of it. And I think that's something that people really ought to know when they are making decisions about the health and safety of their family and their kids.
The best you can. Right now, it has been said that the fired CDC chief is warning the senators right now that RFK Jr. is endangering public health. Right now in the United States, the best you can you explain to all of us in a basic way possible, what are we heading towards now with the way things are going at this current time?
So Secretary Kennedy for decades has been a staunch opponent of vaccines. And again, the reason for this is that he has personally made, as well as the organization he founded, Children's Health Defense, has made millions of dollars off of trying to get rid of vaccines, essentially. So now that he is in charge of all the health of all Americans, he's using his power to take away vaccines in any way that he can. Now, he's not going to outright ban vaccines. He's going to use different administrative levers to manipulate the system so that people can't get access to those vaccines. So one example is that tomorrow, the Advisory Committee for Immunization Practices, or ACIP, is a CDC committee made of external experts that normally gets together a few times a year and reviews all the data for vaccines, and then they make recommendations. Those recommendations determine whether or not insurance providers reimburse for those vaccines and whether doctors will recommend those to their patients. The ACIP was fired in June, the actual experts, and replaced with now it's up to 15, I believe, or 13, essentially anti-vaxxers. So they are going to make recommendations specifically about the MMRV vaccine. That's the MMR measles, mumps, rubella vaccine, plus varicella, which is chickenpox. They're probably going to de-recommend that for people under the age of 4 years old. That would severely delay the rate at which some people can access that vaccine. They're also likely going to de-recommend newborn hepatitis B virus vaccination, which will cause eventually HBV rates to increase. And over time, that will increase the rates of liver cancer. So these decisions that they're making, they're not taking the vaccines away, but in effect, in reality, they are taking the vaccines away because people won't be able to have access to them. And that's incredibly dangerous, because if they do that with these two vaccines, all of these other vaccines that have been proven for decades to be safe and effective and have eliminated many of these diseases from the American population are going to be coming back. And I have done, at a recent conference that I attended, I did some projections about what the consequences would be if some of those vaccines stopped today. So within 10 years, if we stopped the MMR vaccine, for example, there would be 3 million cases of measles per year, 3 million cases of rubella per year, 1 million cases of pertussis per year if they got rid of the DTaP vaccine right now. There would be 30,000 cases per year of paralytic polio virus. That's irreversible. That causes permanent disability. It's a really, really grim outlook. I think that a lot of people do not realize how severe these diseases actually are, how many people, all children, they have killed in the past. And unfortunately, I'm really, really afraid that we're not going to realize it until it's too late and we start seeing those rates again.
So we are speaking with Dr. Rasmussen, who recently testified before Congress. We're talking about the skepticism now amongst parents when it comes to vaccines and the big changes at the CDC with RFK Jr. at the helm of Health and Human Services. What should we do then if the CDC was the agency that the health industry or health officials would look to for direction? What are we supposed to do as the public? Like, who are we listening to?
So this is a really, really good question, and one that I unfortunately don't have a great answer for. I do want to correct you really quickly, because I didn't actually testify before Congress recently. The meeting that I referred to that I attended is called the Vaccine Congress.
Gotcha. Okay. Thank you for that clarification. Thank you so much. Yes, we want that.
But I think, that the situation is really unprecedented. So for decades, the CDC has set the global standard for what a public health agency should be. And right now, between these policies and the fact that, thousands of people have been fired from the CDC across all of these different divisions, as we just discussed, not only was Dr. Moneras fired as the CDC director, but 3 other senior leaders at CDC resigned rather than participate in a non-evidence-based process that would take vaccines away. The CDC's capacity is severely reduced, and the information that they're providing, the recommendations that they're making, are no longer trustworthy. So there have been some workarounds to this. So there are some private groups, including a group called the Vaccine Integrity Project that's led by Michael Osterholm at the University of Minnesota. That's largely an academic group that has gotten together. There are societies, professional societies. So, for example, the American Academy of Pediatrics has put out its own guidance about vaccines. And some states have banded together as well, including Washington State, which has formed a coalition with Oregon, California, and Hawaii to make sure that they are not only providing good public health recommendations, but they're also going to try to ensure access to those vaccines as best as they can. I think that it's certainly good that we have something to step into the CDC shoes. But the problem is now this is going to become a large patchwork of all these different organizations that are all making recommendations that are probably going to be very similar, but may not apply to every single person and may also not be binding. Now, the one good thing that just came out last night is that the Society for Health Insurance Providers came out with a statement, consensus statement from all of the major insurers that said that vaccines have to remain available. And so I think it's actually quite remarkable that you have all of these health insurance companies coming out and saying, we actually would like to reimburse for patient care about these particular vaccines because they are so safe and effective, and they really, really reduce the disease burden on the population. So we do have some of these workarounds, but unfortunately, we don't have any longer a trustworthy national source. And this is going to be a real problem, particularly if there is some kind of health emergency that occurs against this backdrop of what I think is going to be emerging epidemics of preventable diseases that we haven't seen in decades.
Well, one of the things I suggested, and this is what I'm doing for myself, is taking my direction from my personal health provider, who I have trusted all along.
I think that's a really great move, Ursula. And I was just back in the Pacific Northwest visiting my family this past weekend, and I had a conversation with my parents as well as my brother about talking to their physicians about potentially accelerating any vaccine schedules for vaccines that they might not be due for a year or two, but seeing if they can get them now while those vaccines are still available, because I do anticipate that we are going to start seeing vaccine shortages at the very least, even if access isn't completely removed to many of them. So definitely talk to your provider, talk to a healthcare professional that you trust, who can make recommendations about how to keep yourself and your family as safe as possible.
We're joined here by Dr. Angela Rasmussen, epidemiologist here on the Gee Ursula Show. Ursula and I, we try to talk about these things. We haven't talked about it a lot. We haven't had you on the show, but obviously it is very important to talk about it now. What are some things, what are some effective ways that Ursula and I can talk about this, especially being able to counter some of the vaccine misinformation? Dr. Rasmussen, I feel like a lot of the information that we are hearing now are really coming from people who don't even study science. How can we counter this?
Well, so this is something that I think about all the time, because what I keep hearing from Secretary Kennedy, from NIH Director Jay Bhattacharya, from FDA Commissioner Marty McCary, is that there's no more trust in public health. Somehow this has all been lost because of the pandemic. And to a degree, that's certainly true. I mean, there were public health measures put in place that in hindsight, maybe weren't the best way to deal with it. But you know what we also did during the pandemic? We managed to get vaccines that have saved millions of people's lives out onto the market, safe, effective vaccines within 10 months. That was a huge achievement, and it did save millions of people's lives, and those vaccines continue to save people's lives. And I think one of the things that we can do is really listen to people who are sharing some of this information, understand what their concerns are, and try to address them as best as we can with facts. I mean, if somebody says, oh, well, I heard that the COVID vaccines cause turbo cancer, or that you're going to be shedding the spike protein, or all of these things, none of those things are actually true. And you can push back and say, actually, none of that's true. And these vaccines, in fact, did save millions of people's lives. There are people walking around today that would not be otherwise if it weren't for the COVID-19 vaccines. And I think, we all know people who've gotten COVID. Most of us have actually gotten COVID. It took me until 2023. But when I got COVID, I have asthma. And I found it really remarkable that 5 or 6 vaccine doses in, I had almost no respiratory symptoms at all. I was tired and I didn't feel well, but the disease was considerably less than it would have been if I was unvaccinated. So these vaccines work. And I think that the evidence that we have, even simple evidence that they save lives, can really make a difference with people when we engage them and take them seriously and treat these concerns as valid, but also recognizing that a lot of this misinformation is simply not true.
Dr. Rasmussen, we got about 2 minutes, and I'm sure Ursula might have another one after me. Back to your comment about the vaccine saving lives. I have to say, Dr. Rasmussen, for some reason, I think that we are split in this country on that. And I think, and it feels like some believe that the vaccine has actually taken lives, and some believe, like you, that, and someone who studied this, that the vaccine has saved millions of lives. How do you dispute the misinformation centered around that?
Well, I would just say that every time I've asked somebody for evidence that these vaccines are killing people, there's an entire movie about this called Died Suddenly that implies that, somebody would get a COVID vaccine and then they'd drop dead basically the next day.
Uh-huh.
None of this is actually true. And so if you ask people who are saying this, and this is my experience a lot, I have a lot of Twitter followers and many of them really don't like me. I'll say, show me the evidence that like these people are dying. And then I usually get insulted. There is no evidence to suggest that these vaccines are dangerous. Every vaccine, every drug that exists has side effects. So yes, like sometimes people can go into anaphylactic shock. That can happen with almost any vaccine platform. It can happen with certain drugs. It can happen when you eat certain foods if you're allergic to them. These are normal things that, nothing is without some level of side effects. But at population level, all of the evidence shows that these vaccines are safe. They are very effective. And while the numbers differ, because the way you calculate this is with mathematical modeling, they have saved millions of lives, as little as few as 2 million lives, as many as more than 15 million lives. So you can debate those numbers, but in my opinion, the lower end of that spectrum, that's 2 million people's lives that were saved by these vaccines. That's a huge achievement. And I think that it really makes a lot of sense to me to say, all right, let's compare evidence bases then. Because the people who are saying these things about vaccines have nothing to share from their evidence base. They have manipulated data. They have distorted reality. They have mischaracterized the actual science, and they really can't produce any evidence to counter the argument that the vaccines do, in fact, save people's lives, keep them out of the hospital, keep them out of the cemetery.
Dr. Rasmussen, we sure appreciate your expertise and your willingness to join us on the show. Thank you for the work that you do.